Assalamu alaikum. I am Dr. Jamil Abbas from the Physiology department, and this lecture is in continuation of your renal physiology. And today we are going to study the micturation, the process of micturation. That means the process how to pass the urine, how to empty your bladder. Now, if you go through this your renal system or the physiological anatomy, this you will find that you have got both the kidneys and you have got the suprarenal glands over there, and this is a ureter. Follow my cursor. This is the pelvis of the kidney, and here is your ureter, which is going down to enter into the urine. This is your urinary bladder. In the urinary bladder, both the ureters, they are going to join the bladder over here. And bladder is temporary storehouse or the storage site for the urine. Once the bladder is filled, then you can empty your bladder according to your desire, according to the nervous system. Now the nerve supply of the urinary bladder. It's quite complex nerve supply of the urinary bladder. You will see that the urinary bladder is supplied by the three types of the nerves. One is the sympathetic nerves, other are the parasympathetic nerves, and third one are the somatic nerves. So the sympathetic nerves, which are originating from the T10, T11, 12, L1, L2, and they move into the hypogastric ganglion. From here the hypogastric nerve arises, and they ultimately supply the two areas, the detrusor muscles, which are the smooth muscles present within the wall of the bladder. Smooth muscles, you can see the smooth muscles over here. Here you have got the smooth muscles present within the wall of this urinary bladder. So the name of those smooth muscles within the wall of the bladder is known as the detrusor muscles. So this is the body of your bladder, and here you have got two types of sphincter, which is known as, one of the upper one is known as the internal urethral sphincter, and then we have got an external urethral sphincter, and between these two sphincters in males we have got the prostate gland. We have got the prostate gland between these two, but in females prostate gland is absent, and even this internal sphincter is not marked or is not evident in the females. In the females, urethra is quite small. That's why the urinary tract infections are quite common in the females. So in the female, there are two differences. One, the prostate is not here. Second thing is their internal sphincter is not anatomically marked as shown in the or as it is present in the males. And then we have the common external urethral sphincter. So the sympathetic nerve supply is moving through, coming from the T10, 11, 12, and L1, L2. These are the name of the different vertebrae. T means thoracic 10, thoracic 11, thoracic 12. L means lumbar 1, lumbar 2. Sympathetic, they are going to join the hypogastric ganglion. From here, the hypogastric nerves are originating, and they are supplying two areas. One is the body of the you can say the urinary bladder and the detrusor muscle. Other supply, they are going to supply the internal urethral sphincter. Then we have got the parasympathetic. Now again, keep in mind that sympathetic nervous system is come as for the sympathetic as for the storage. Whenever you need to store the urine, that means when you want to increase the volume of the urine, suppose urine is dribbling or drop by drop it is going to accumulate in your bladder, and you need to accommodate those coming urine, then this sympathetic nerve will be activated. So this sympathetic nerve, they are concerned with the storage of the urine in the urinary bladder to accommodate more and more urine in the urinary bladder. And then we have got the parasympathetic. The parasympathetic works against that sympathetic, opposite to that sympathetic. It is concerned with the emptying of the bladder. Also, it is known as the motor supply of this urinary bladder. Wait a minute. These originating from the S2, S3, 4, sacral 2, 3, 4. Here you have got the reflux center for the micturation, which is known as the micturation reflux center present over here. And they are originating from this area, and they are going to join a pelvic ganglion, from where your pelvic nerves are originating, which are known as the nervi erigents. Pelvic nerves are coming out, and they are supplying to this detrusor muscles and to your internal urethral sphincter. So your internal urethral sphincter is supplied both by the sympathetic and the parasympathetic nerves. Keep in mind that this pelvic nerves or the pelvic nervi agents, they contain motor fibers and they also contain the sensory fibers from the bladder. So sensory fibers, the afferent and efferent items, branches are both present in these nervi agents, in these pelvic nerves. Then third one is the somatic control, somatic nerve, that is known as the pudendal nerve. The name of this is the light green area. This is your pudendal nerve, which is supplying to the external urethral sphincter. This somatic control, or through this pudendal nerve, you can temporarily postpone the process of the micturation. And while widening of the urine, widening means you are going to pass the urine, you are going to empty your bladder. Widening of the urine, you have to dilate, you have to stimulate this pudendal nerve. You have to inhibit this pudendal nerve. Normally, this pudendal nerve keep this area inhibited, or keep this area, or you can say your external sphincter remains contracted, so the urine cannot be moved out. So three nerves are supplying: parasympathetic system, sympathetic system, and the somatic control. We will see in detail all these things. And these are the different types of the, because we are concerned with the autonomic nervous system here, so we have got different types of neurotransmitters which are used. So in the pelvic nerves, we are used the bladder has got the muscarinic receptor, which are known as M3 receptors, and the neurotransmitter is acetylcholine. While the hypogastric nerves, which are the sympathetic ones, they are going to affect on this beta receptor, are known as the B3 receptor, the beta receptor, which are here the release of the noradrenaline. So the noradrenaline released on the bladder wall and also on the internal urethral sphincter. Then this here is supplied with the alpha-1 receptor. The alpha-1 receptors are present over here. Then we have got the external urethral sphincter. This is also known as urogenital diaphragm. This area is also known as, when you will study the anatomy of all these things. Then here we have got the, again, the pudendal nerve. Pudendal nerve is going to release acetylcholine, and we have got the nicotinic receptors over here. So there are different types of receptors present here: muscarinic receptors, the beta receptors, and we have got the alpha-1 receptors, we have got the nicotinic receptors, and different types of the neurotransmitters are used over here. Now we have got some micturation, different types of micturation centers. Micturation centers present in the sacral region. This is brownish area. This is the micturation center present in sacrum. It's present S2, S3, 4. This is the micturation center present in your sacrum and is locally controlled and your urinary bladder. Then if you move up into the brain, you have got the Pontine micturation center. And then we have got the higher center, which may be present in the basal ganglia and the frontal lobe. It is more sensory motor sphincter control area. These are the higher centers which are present in different areas of the brain. So the most prominent one is the frontal micturation area, and we have got the Pontine micturation area, and we have got the reflux center in the sacral region. Few words about this Pontine micturation center. Normal, as the name indicates, its location and its function. Pontine means present in the pons. Micturation means it's going to cause the micturation. So whenever this center, the Pontine micturation center, is stimulated, the micturation will start. Normally, the higher center, that is the frontal micturation area, and this one, they kept this area inhibited. So this Pontine micturation center is normally kept inhibited by the higher centers. So once the higher center, because the higher center, they are responsible to pass the urine whenever you find a socially acceptable place for the widening of the urine, for the emptying of the bladder. So frontal micturation area particularly, they kept this Pontine micturation center normally inhibited. And once you need to empty your bladder, this center will release this Pontine micturation center, and its function is now to pass or to stimulate this area and to pass the urine onward. This same things are written over here, which I told you earlier. The nerve supply, we have got sympathetic nerves, we have got the parasympathetic nerves, and then we have got the somatic nerve, that the pudendal nerves. These pelvic nerves, which are the pelvi arranger, they have got both sensory and the motor fibers to the urinary bladder. Motor fibers are parasympathetic. I have told you earlier. Now, what happens during storage phase? Storage phase, when you are not willing to empty your bladder, you have not filled the bladder properly. So the storage phase is there. The internal urinary sphincter remains tense, and the detrusor muscle, they are relaxed. Actually, tense means remains contracted, and detrusor muscles are relaxed by the sympathetic stimulation. I have told you earlier the sympathetic nervous system is concerned with the storage phase. S for sympathetic, S for the storage. Then the micturation phase, when you are going to empty your bladder. Definitely, if you keep in mind an example of a dropper present in the different types of the drops. So to move the medicine out of the dropper, you have to contact the upper top, rubber top of that dropper. When you contact it, and then the medicine will move down, and you have to relax the sphincters. So to pass on during micturation phase, the parasympathetics become activated, and stimulation causes the detrusor muscle to contract and internal uterine sphincter to relax. Definitely, when you contract the bladder from the top, you have to relax the sphincter to empty your bladder. Then the external uterine sphincter, so sphincter urethra is under somatic control and is consciously relaxed during micturation. That means it is under your will. The external uterine sphincter, which is supplied by the pudendal nerve, is under your will. It is your somatic control. You can contract it, or you can relax it by yourself. Again, the same things which are written over here. I have told you earlier, the autonomic nervous system, the parasympathetic, which is concerned with the bladder emptying. Keep in mind, the parasympathetic concerned with the bladder emptying, and is coming from the S2, 3, 4 motor to the detrusor. That means they are going to contract the bladder. That means when you are concerned with the emptying of the bladder, you have to contract the detrusor muscle, you have to contract the bladder, and inhibit the internal urethral sphincter. That means to start the micturation. Then we have got the sympathetic. They are concerned with the bladder filling or the storage. It is coming from the T10 up to the L2. I have told you earlier, the motor to the sphincter, inhibited to the detrusor. That means whenever the bladder is relaxed, that is your detrusor muscle, it should be inhibitory phase, and at the same time your motor sphincters, this T1, T2, they are motor to the sphincter. That means your sphincter, they remain contracted, and detrusor muscle will be inhibited, that it will be relaxed. So one thing very important to understand, whenever you are contracting the bladder, whenever you want to empty the bladder, you have to contract the detrusor muscle, and you have to inhibit the your sphincter. You have to relax the sphincter. You have to contract the muscle, you have to relax the sphincters to empty your bladder. And whenever you want to store the urine, at that time you have to relax the detrusor muscles, and you have to contract your sphincters. That means sphincters should be closed, and your muscle should be relaxed. Detrusor muscle should be relaxed during filling of bladder filling, under the control of sympathetic nervous system. Somatic, that is the pudendal nerve, is coming from the micturation reflex center S2, 3, 4. Then the voluntary control of micturation is attained by the age of 2 to 3 years. That means normally the child, they learn how to empty your bladder, how to empty their bladder at the age of 2 to 3 years. What is meant by the nocturnal micturation, that is bedwetting. Nocturnal means at night. That considered normal age, this up to the 3 years of age, bedwetting or the passing of urine during sleep is taken as a normal one. And this is due to the incomplete myelination of the motor nerve fibers to the urinary bladder, resulting in the loss of voluntary control of micturation. So this is normal up to the age of 3 years, bedwetting. Then few words about the Pontine Mixturation Center. I have told you the name and its location is under its name. That is, Pontine means location is present upon micturation. It's cause of micturation, cause emptying of the bladder. Now located in the rostral pons in the brainstem, involved in the supraspinal regulation of the micturation. That is urination. PMC or the Pontine micturation, when activated, Pontine micturation center when activated, what it will do, it will relax the uterus sphincters and allow for urination, or you can say the micturation. The PMC coordinates with the other brain centers including the medial frontal cortex, insular cortex, hypothalamus, periaqueductal gray area. Periaqueductal gray area in particular act as a relay station for ascending bladder information from spinal cord and incoming signals from the higher brain area. Now, Pontine Maturation Center is responsible for the micturation and it is kept inhibited by the higher centers. When the higher center will desire to pass the urine, this Pontine Maturation Center will be activated. Normally it is kept inhibited, but once it is activated, it will cause the emptying of the bladder. Now the micturation center. This diagram is very important, the micturation center. Here the diagram of the bladder is the urogenital diaphragm. This is urinary genital diaphragm. Here you have got the external urethral sphincter. Above that you have got the internal urethral sphincter, and these are the sympathetic nerve supply, the hypogastric nerve, sympathetic nerve supply, and the greenish one, sympathetic nerve supply, and this is known as the hypogastric nerves. And then we have got the parasympathetic. This both one is the parasympathetic nerve supply, the light blue color, the parasympathetic nerve supply, and the pelvic splenic nerves, the purple color. Now once micturation center, micturation reflux, this is your micturation center. Micturation reflux means how you pass the urine, how you empty your bladder. It is a reflux action which is manipulated in your sacrum but is controlled by the higher centers. So once you fill your bladder filling is more and more. What happens? The stretch impulses here in the walls of the detrusor muscle, in the walls of the bladder, you have got the stretch receptors. So the impulses will move through the pelvic nerves. The afferent impulses from the stretch receptor, they will move to the sacral areas in your reflux center. From here, it will move up. From here, it will move up. Sorry, I have moved to the next diagram. From here, it will move up and it will directly pass to the Pontine Maturation Center. It has got going to stimulate this Pontine Maturation Center. So all this is a number one. What happens? The impulses will move through the pelvic nerves, which is afferent impulses. The afferent means towards the brain. The afferent impulses moving towards the brain. First they will reach to your reflux center in your S2, 3, 4. Then they will move up straight up to the Pontine Maturation Center, and they are going to stimulate this one. And normally this Pontine Maturation Center is kept inhibited by the higher centers, and higher center will allow to stimulate it. And the stimulation is coming from the unibladder also, and the inhibitory, this Pontine Maturation Center will be released by the higher center whenever you find it socially acceptable, or you will find a toilet to empty your bladder. So this is stimulated, the Pontine Maturation Center is stimulated by these impulses which are coming from the pelvic nerves, and they will send impulses down to your spinal cord. From here there are two branches. One branch is going to inhibit your sympathetic system. That sympathetic system concerned with the storage of the bladder. Now you need to empty the bladder. You don't need to store the bladder. So the storage should be inhibited. So this one branch is going to inhibit the storage system of the bladder. Other branch will go down and reach it to the reflux center, micturation reflux center in the S2, 3, 4. Here we have got again two branches. One is going to stimulate your bladder through pelvic splenic nerves. Actually, these are the same nerves. Fibers also shown different colors, afferent and efferents. So it is going to stimulate your unibladder, and it is causing the contraction of the detrusor muscles. And basically, these are the parasympathetic fibers. They are going to stimulate your detrusor muscle. And the other branch is inhibitory, and this branch is going to your external urethral sphincter that is supplied by the pudendal nerve. So the pudendal nerve is inhibited now. That means your external urethral sphincter relaxed. So once your external urethral sphincter relaxed, detrusor muscles they are contract, you can empty your bladder. So this was all about the micturation reflux, which is usually university question. Storage reflux is not usually asked. The main university question is your micturation reflux. Here the same diagram. Then the onus nucleus. Actually, this nucleus is located in the ventral part. Here you can see the onus nucleus. This is the onus nucleus. Again, this is the onus nucleus. This is present in the ventral part and the lamina 9 of the anterior horn of the S1. It controls the micturition and defecation continence voluntarily. And muscular contraction during orgasm, during orgasm contains motor neurons and is the origin of the pudendal nerve. This onus nucleus is the origin for the pudendal nerve. Just you keep in mind, memorize one thing: the onus nucleus is the origin of the pudendal nerve, and pudendal nerve is voluntary nerve, and somatic nerve is going to supply your external urinary bladder. Then, what are the different types of the pathologies concerned with a bladder? One is known as the atonic bladder. Atonic bladder means when your tone of the bladder is lost. What is meant by the tone? Tone is the partial state of the muscle contraction. So your muscles, particularly smooth muscles, they remain in a partial state of contraction. They are not fully dilated, they are not fully contracted. Atonic means the tone is lost. The partial state of contraction is lost. So the muscles, they are going to relaxed. So atonic bladder, detrusor muscle is relaxed. Atonic bladders are the large bladder because your muscles are relaxed, large bladders that have become dilated but are not emptying. That means bladder are filling, and it is not emptying properly. They're not emptying properly. Individual will feel the pain. That when the patient will feel the pain. Where the lesion? Lesion is the sensory nerve supply from the bladder. Usually the motor supply is normal. Here we move back to clear the. Here this bluish color is here the problem is. Whenever these nerves are damaged, they are damaged in diabetes, they are damaged in the tapes dorsalis, they are different. Whenever these nerves are damaged, they are damaged in multiple sclerosis, they are different name of the diseases. So when this is damaged, it will lead to because the bladder remains or continue to fill more and more, but the stretch receptor, they are not functioning. So once they fill up to their maximum capacity, then the urine will begin to dribble down. It will move. You can say the overflow incontinence. Incontinence means you can't control the micturition. So there will be overflow incontinence. So the lesion is in this area, and not in this area. This area, which is the motor fiber, there usually remains normal. Atonic bladder, a large bladder, dilated bladder. Actually, this is a type of lower motor neuron. When this terminology lower motor neuron you can't understand at this level, when you study this, your CNS, then you can understand this lower motor neuron. It is a type of the lower motor neuron lesion, and the lesion is in a sensory nerve supply from bladder, and the motor supply is usually normal. What will result of this one? The overflow incontinence is prominent. That means that urinary bladder will fill up to its maximum limit. Then there will be overflow. Then what happens? What are the causes? There's crush injuries to the sacral regions, diabetic patients, and syphilis, and multiple sclerosis, and enlarged prostate. They usually cause this atonic bladder. Then we have got the automatic bladder. Automatic bladder, that means bladder become automatic. It will fill automatically, it will empty automatically. Patient doesn't know what's happening there. Normally, we pass the urine under our will. Passage or micturition is under our control. But here it becomes automatic. You can't control it. Causes damage of the spinal cord above the sacral segment, center for the micturition. If the micturition center is normal, then above it, if there is a damage, the gunshot wounds or other type of the damage, they will lead to the automatic bladder. That means the loss of brain facilitatory or inhibitory control over the sacral micturition center is lost. That means your micturition center in the your reflux micturition center is in the S234 is normally, or it is saved, and the damage is above it. So the brain facilitatory or inhibitory impulses are not there. What will be the result of this one? The micturition reflux become hyperactive. That means whenever the bladder will fill to some extent, the reflux will be activated and it will cause the emptying of the bladder. There is a periodic but unannounced bladder emptying. bladder will feel incompletely empty, but without the knowledge of the or the control of the patient. Actually, what's happening there? The patient came to know how to empty your bladder through your higher centers, through your center present in your brain, through the center in the Pontine Maturation Center. But here, there is no correction. Where the lesion? I will show you through your diagram. Here, the lesion is usually here, in this area. This is your center, but in the atonic bladder, lesion is in this area, but in the this automatic bladder, lesion is in this area. So higher center cannot control this micturition center. Once the bladder is filled to some extent, the impulses will move to this one, and it is going to empty itself through its connection. Here is the connection. It can stimulate this one, pudendal nerve, and ultimately what will happen, that your bladder is going to empty. So this is the second type of the lesion, which is known as the automatic bladder. This is known as the overflow incontinence is a prominent one, but this overflow is not like that of the this is a automatic bladder. The bladder will fill to some extent and it will empty immediately. Then we have got the uninhibited neurogenic bladder. Uninhibited means bladder is stimulated. Uninhibited, the two wordings, they are combined together. Lesion is at the level, or you can say above the Pontine Mixturation Center. It is usually present in the higher center of the brain, in the medial frontal cortex. It may be the congenital or the acquired. In it, there is a loss of inhibitory control of CNS on the Pontine Mixturation Center, and the Pontine Mixturation Center remains excited all the time and ready to cause micturation anytime. That means your PMC or Pontine Maturation Center is now free. It will cause a maturation again and again. So when it will become activated, Pontine Maturation Center, the higher center, the connection between the higher center and the Pontine Maturation Center is lost, or this PMC center is stimulated by the higher center. So the PMC is free and micturition reflux is intact. So result will be it is uncontrolled frequent emptying of the partially filled bladder. Patient cannot store the urine due to the continuous excitatory impulses from the Pontine Micturition Center. Continuous excitation down to the sacral micturition center to S2, 3, 4. Even a small quantity of urine in the bladder will elicit the reflux. Just like a baby, just like a neonate, you empty your bladder. So these were the three types of the pathologies. Atonic bladder, we have got the atonic bladder, we have got the automatic bladder, and then we have got the neurogenic bladder. So in the atonic bladder, bladder is dilated, flaccid, and overflow incontinence there. And the lesion is in the sensory fibers. Automatic bladder, the bladder will fail to some extent. It's not completely filled as it was filled in the atonic bladder. In the atonic bladder, the maximum filling of the bladder is there. But in the automatic bladder, small amount of urine is going to stimulate your reflux. And then we have got the uninhibited neurogenic bladder, which is due to the higher center problems above your Pontine Maturation Center. These all are your references. Then we move to the pressure changes in the bladder. Empty bladder, the pressure is 0. 100 ml of the urine pressure is 10 centimeter of the water. Up to approximately 400 ml pressure remains 10 centimeter of water. This is because stress relaxation phenomena. Actually, these detrusor muscles, they are the smooth muscles. And smooth muscles, they have got a phenomena which is known as stress relaxation. Normally, once if you take a rubber, if you stretch it, then it shows the contraction. But in smooth muscles, they will, once you stretch them, they relax themselves and they will acquire a new, they will relax themselves and they can accommodate that stress. So this is because of stress relaxation phenomena. That means when the bladder is going to fail more and more, the detrusor muscles, they relax themselves under the effect of stress relaxation phenomena. And according to the law of Laplace, the pressure is equal to the tension and divided by your, where the tension divided by the radius. So this is the pressure. At 100 or above, desire for maturation may feel, but vague, that means very small or weak and controllable. Again, I'm going to repeat the things. The empty bladder, pressure is 0. Then when the bladder filled by 100 ml, the pressure is 10 centimeter. Then it remains 10 centimeter up to the filling of bladder up to the 400 ml. That means your bladder is filling, but your pressure will remains within the 10 centimeter up to the 400 ml filling of your bladder. Due to the, why it is this? Due to the stress relaxation phenomena. Now, once during you can feel the urge to desire urge or desire for maturation at 100, but it is very weak and you can control it easily during further addition of 300 ml of the urine. So that means when your bladder is going to fill above 700 ml, then the pressure rises up to 40 centimeter of the water and maturation is uncontrollable now. It's no, you can't control it when your bladder is filled more than 700 ml of the urine. And this diagram shows the different spikes. Here is during the volume which is increasing, here the volume and then the intravesical pressure. So the volume is increasing from 0 to 100 ml. So there is a very vague, or you can intravesical pressure remains 10. And these are the micturition contraction. That means your smooth muscles, they are showing small amount of contractions over here. Small spikes are there. But once your bladder is moving above 400 ml, then spikes are becoming more and more. And above 700, you can't control the micturition. These things are written over here. 3 to 50 3 millimeter mercury urine in the bladder. Sorry, this is not proper. Ml, this should be ml of the urine. This 30 to 50 ml of the urine in the bladder, pressure rise to 5 to 10 centimeter water. When it will move to 200 to 300 ml, the pressure rises minimum. That I have told you earlier that up to the 400 ml, the pressure remains up to the 10, up to the 400 ml. This you see the 10. If you move a diagram in this way, then above, when you move, the bladder is going to fill above that one, and up to 700 you can't control. Above 700 you can't control it. So this was all about the urinary bladder. Thank you very much. We will see you in the next chapter. That is the reabsorption. Thank you very much.